Hello, nation. Heart disease is the #1 cause of death in both people with type 1 and type 2 diabetes. However, the risk factors for heart attacks and strokes, two components of heart disease, are totally treatable, and heart disease is preventable. But here's the problem. Many of the risk factors that lead to heart disease are what we call asymptomatic. They don't cause you any pain, and you may miss the fact that you have these risk factors out of control, and that's an issue because that'll lead to heart disease. Let's go over the basic ones. The first one, high blood pressure. No symptoms of high blood pressure. Your systolic over diastolic should be at least less than 140 over 90. Now, as a professional, don't forget, I am a doctor, I think people with diabetes should be less than 135 over 85. Number two, abnormal cholesterol levels. Once again, no symptoms when your LDL cholesterol is through the roof. That's a serious lipid abnormality, should be at least less than 100, and for some of you, less than 70. Triglycerides, a form of fat in our blood, should be less than 200, and of course HDL, the good cholesterol, should be as high as possible. We don't have much control over our HDL levels except our parents. Now, what is the third? The third is the propensity to cause blood clots. That may be people with diabetes, our blood is a little thicker. These little clots can break off and go to certain areas of our heart and our brain and can lead to a heart attack and stroke. And that's why most people over the age of 50 should be on a baby aspirin, and some of you will be on stronger blood thinners. But once again, it's a conversation with you and your caregiver. Now, lastly, what about glucose control? Super important. We all should be familiar with the hemoglobin A1C. We're all trying to get down to 7%, at least less than 8%. And that's an average blood sugar of about 150 to 160. So that's another important issue. And along with lifestyle, we want to address all these risk factors. Now, the last thing I need to tell you is that there has been some exciting, cutting edge information about how to reduce our risk for heart disease. There are two new classes of medication for people with type 2 diabetes that not only lower the glucose, but have been proven to protect our hearts. The first class, ready for this, is called SGLT2 inhibitors. You can see some of the names on your screen. The second class is GLP-1 receptor agonists. And once again, some of the common drugs approved by the FDA are on your screen. Now, currently, these drugs are approved only for people with type 2 diabetes, but just wait, they may eventually be approved for people with type 1. So it's kind of an amazing area we have now, and even your caregiver may not know about this new information, that these medications can reduce your risk for heart disease and help control your diabetes. So remember, heart disease is common, but it is preventable. You need to know all of the risk factors, talk to your caregiver, and make sure every single one is at goal. So take care of your heart, nation. It's important. So long.